people
the
that
handler of magnetic
are
movement
part of this collaboration
here
and the public.
at the
I will
Capitol,
say that I am a little bit disappointed
here to
that this is
say,
not
hell no,
as well
go fuck yourself.
televised, or I
Let's
should say
hear what they got to say.
promoted, not televised, so that more people from the public had an opportunity to really listen. I think this is very important for the future of our state and the decisions that are being made here. And I think that the public deserves to be fully aware of what the choices are that the state is making. And I'm glad to see that at least some people found out about it. Just publicizing something in our calendar is really not enough on such an important topic. So I'm hoping that this will be one of many open conversations that we have concerning the topic that we're going to discuss today. Thank you.
Thank you, Senator Summers. Representative Clara D'Estria.
Thank you, Madam Chair. Thank you, everybody, for being here today. And I'm not going to repeat what my fellow colleagues said, but I just want to make sure that even though we all may have very different opinions on vaccines, I stress the fact that we all make sure that we respect whomever's speaking at the time and give each person that respect, because we know we all expect it from all of you. Thank you, Madam Chair.
Thank you very much. And with that, we will move to the first panel. We have 3 panels today. Our first panel is our academic colleagues and experts who are going to talk to us about understanding infection prevention and the value of vaccines in academic and scientific perspective. I will introduce them by name and let them introduce themselves, make a few brief remarks. We will then have limited, again, legislative Q&A. And we will then move to our second panel with our state agencies. Our final panel will be with our medical providers. And with that, I am going to turn it over to Dr. Linda Nicolai from the Yale School of Public Health. Welcome, and please introduce yourself, and we're happy to hear your remarks. Thank you very much, Dr. Nicolai.
Thank you. So thanks for the opportunity to speak with you all today. I have about 5 minutes of remarks. Is that appropriate?
That's perfect.
Okay. So my name is Linda Nicolai. I'm an infectious disease epidemiologist. I've been a professor at the Yale School of Public Health for 23 years, focusing my research on vaccines and diseases. Today, I'd like to provide a brief science-based overview of the role of vaccines in promoting health. Vaccines do represent one of the greatest achievements in biomedical science and public health. I will speak to their effectiveness, their safety, and the challenges that we're currently facing. Again, I will do this in 5 minutes. So effectiveness, again, I'm speaking as a scientist. So what I talk about is all grounded in the evidence that has been generated from rigorous, robust studies that can be replicated. So effectiveness. The data overwhelmingly supports the effectiveness of vaccines in preventing disease and death. At the beginning of the 1900s, infectious diseases were rampant in the US. These diseases that cause millions of cases of illness every year have been reduced by greater than 99% over the past 125 years or so because of the routine vaccinations we now give our children. This includes smallpox that has been eradicated, polio that has been virtually eliminated, and many, many others. Today, the routine immunization schedule we give to our children today is estimated to prevent 4 illnesses per child. So every child who receives the routine recommended vaccines be averted 4 illnesses. 1 in 3 children don't end up in the hospital because of these vaccines, and they prevent over 1 million premature deaths. So we really have a lot of evidence that they work.
Fuck your research.
Given their success in
I do know that the dollars control the research, you motherfuckers. Just saying, you know. Seriously.
Other diseases are rare, but still do occur and can have devastating consequences. Think of meningococcal disease, for example, that can result in death and otherwise severe sequelae, hearing, vision loss, brain damage, and limb amputations. Finally, some diseases that we don't usually see in the U.S. still exist globally, and travel, I think we're all aware, can present a risk of imported cases leading to ongoing transmission as we are now currently experiencing the diseases. So we really do need to remain vigilant. Regarding safety, this is a crucial question for everybody, right? We all want vaccines to be safe for ourselves and for our families. So it's an important question to ask, and it should be answered with the evidence-based science. I want to begin this brief remark by acknowledging that no vaccine is 100% safe. Vaccination does lead to side effects, pain, tenderness, fever, swelling, people can have allergic reactions. The important way to frame the question, however, is
have you ever seen the bottle of one of these motherfucking pharmaceuticals? Their prescription, death. Fucks you up.
Based on scientific evidence,
Stop taking these goddamn pharmaceuticals. Just saying.
Clearly outweigh the risk of acquiring vaccine-preventable diseases that are associated with far greater morbidity and mortality. The bar is set really high for vaccine safety, higher than for any other medical product out there, because we generally give them to healthy people with very low tolerance for risk. They are held to the highest standard of safety of all medical products. They are extensively studied. Our monitoring systems, they work, and I do not have time here today to go into how those licensure monitoring systems. They continue to look for potential, rare but potential side effects from vaccines. But I just want to let you know the systems we have in place do work. And the example about that is related to rotavirus, which is a vaccine that was introduced in the US in the late 1990s. After it was recommended, the systems we have in place detected a rare but serious side effect, intestinal blockage, and resulted in the vaccine being pulled off the market within months of the signal being detected. So our systems work, so we should have confidence that the vaccines that we're using are safe. The final point I'm going to make about safety before I wrap up is that many safety concerns are anecdotal and not grounded in science. Children receive a lot of vaccines, and some health conditions are diagnosed after receiving vaccines. But that temporal link cannot tell us if the vaccine caused the health outcome. Only well-conducted scientific studies with controlled comparison groups can do that. You will hear people say that they've done their research. What they often mean is that they've looked it up on the internet, they've read about it in their social media feed, they saw it on the news, or they talked about it with family friends. That is not research. That is an unsystematic collection of anecdotes and unverified information.
Excuse me, if I may interrupt, I don't believe you were finished,
I'm not finished, I just needed to take a moment.
And please do. As I said at the beginning of this forum, we are going to, and as actually you heard from all of us, the leaders of this committee, we are asking for decorum so that we can listen and hear our presenters today, and we thank you. Please continue.
And my concluding remarks are to note that we really should celebrate that most parents acknowledge the importance of vaccines and accept them. Most people also have legitimate questions.
Excuse me again. I will repeat that you will be asked to leave the room if you continue to call out. We want you to be here with us. We welcome you to be here with us, but we do not welcome, just as we do at all of our public health hearings, this is no different. So we ask that you respect that boundary, otherwise you will be asked to leave.
And most people have legitimate questions that should be answered in clear language grounded in scientific evidence. But we are experiencing declining vaccination rates that pose risks not just to unvaccinated individuals, but to all of us. The declining rates are due to this phenomenon of rising vaccine hesitancy and loss of trust. So to address this, I want to be clear, and I speak as a scientist, that science is not enough. Science is necessary, but it's not sufficient. Beyond that, effective communication is vital. This starts to listening to people's concerns with empathy and without judgment.
She is talking bullshit.
With appropriate communication about vaccine safety, grounded in science.
That's what you call an ignorant sheep.
The rise of social media and its ability to amplify misinformation and disinformation has made this really, really difficult. We just need to remember that science must remain our guiding principle and that science is on the side of vaccine safety. And finally, there is a lot happening currently at the federal level to undermine confidence in vaccines and to restrict access. So it's important to remember, and speaking from elected officials here, that a lot of vaccine policy and action happens at the state and local level. The states control their vaccine purchasing and distribution plans, they control their immunization registries, they control school entry requirements and exemption policies. People who work for state and local health departments are the boots on the ground, and those are the people who play a really important role in advocacy. So as elected officials, you do have a unique opportunity to promote the health and well-being of Connecticut residents through science-based policies.
Thank you very much. Next, we will hear from Dr. Kevin Niekhaus from UConn Health. Welcome, Doctor.
Okay, thank you for inviting me to speak to you.
You gotta find a seat. You can't just
Oh, no, I just said
I understand. I don't want to make a spectacle. Just have a seat.
Okay.
Connecticut, practiced physician for over 30 years, and probably more importantly, I take care of patients who, in large part, are immunocompromised, so they're very vulnerable to vaccine-preventable illnesses. I'm going to follow up with Dr. Nikolai's comments and address some of the issues with vaccines, but also some of the science and process by which vaccine discussions and policy are made and how these have been affected lately. So just about 5.5 years ago, I was in this building discussing vaccines. COVID had just been described, it hadn't quite hit yet, and a large group of the public was outside protesting. I had the distinctive badge of being vilified as a Nazi in public media for that. Well, 5 years later, here we are. There's been a sharp rise in measles cases in the US in 2025, involving nearly 1,500 people, including 3 children who have died. We've also survived, most of us, a global pandemic. Except many did not.
Oh my God, bullshit.
So over 1 million American lives were lost. And we have
Global power
a great
control.
example of the triumph of science.
Fear control.
mRNA vaccines for
Virus
the
extraordinaire.
pandemic and saved
Our
millions of
government.
lives. And yet again, here we are now. Our public institutions were designed to protect us using the most cutting edge and validated methods available have fallen prey to personalities and providing ideology for the public good. I worry that the process for assessing the effectiveness and safety of vaccines is being corrupted. So when our nation was founded 250 years ago, any child had a 40% chance of dying before they reached adulthood. That number is now 4%. And the reason for that is public health. And the majority of public health is vaccinations. Current leadership have characterized vaccines in all sorts of ways. Crime against humanity, millions have been injured. We just don't know how many lives have been saved by vaccines. It may be true that we don't know the exact number of lives saved, for example, by the mRNA vaccine for COVID, but we have a good scientifically validated estimate, and that's number that's somewhere around 20 million. So we don't know, it's 20 million plus or minus. I worry about the disruptions to the processes to ensure efficacy and safety of the vaccines, and that these issues are no longer being communicated to Americans in a transparent and valid way. The American College of Immunization Practices, or ACIP, has a long-standing history of applying the strongest rigors of scientific evaluation to develop recommendations designed specifically to protect the American public. Now we've gone through some changes recently, and ACIP members have had long-standing knowledge of vaccine data have been removed, replaced with others. These subgroups in the original group, ACIP, take deep dives into the science of evaluating vaccines, the data, very granular data about vaccines, and then report back to the main group for dose. This whole process is transparent, but that transparency has gone away. So members with experience have been removed, years of experience have been removed. The membership has been replaced with handpicked individuals that seek to support ideology over supporting facts and science. There's false narratives and pseudoscience being promoted, and ignoring the preponderance of scientific studies that support the effectiveness and safety of vaccines. So I worry that many of the recent changes or proposed changes to recommendations will also create barriers. Regardless of the science, these barriers are going to affect those who would benefit from vaccine the most. Those like the patients that I'm going to see later today as I head back to the hospital. Some barriers will be from erosion of trust in our healthcare providers who offer science-based recommendations. This will lead to decreased desire to seek out healthy behaviors, such as vaccination. Some barriers will be more structural. Policies that limit vaccine access or limit the ability to cover the cost of vaccinations. And some are just going to be practical, such as limiting multiple dose vaccines, requiring more jabs, and that's naturally going to cause some reluctance in receiving vaccinations. So in sum, there's a number of changes that are happening in our society right now. I feel it's our duty as scientists and as clinicians and as legislators to protect our society, especially those of us who are most vulnerable and able to protect ourselves. It's our duty to put science over ideology. It's our duty to call out what we see as pseudoscience, bad science, mischaracterizations of science, and false narratives about the dangers of vaccination.
COVID, bad science.
It's our duty to focus not on
COVID
politics or
vaccination.
ideology
My
necessarily,
God,
but rather
lying,
on gaining
cheating,
common sense.
stealing, pharmaceutical, government, bad science, eager facts.
So thank you for listening to my comments, and thank you for the audience for being respectful.
Thank you, Dr. Decal. And to my fellow legislators, we will have questions, and I can guarantee for all of us, knowing how we are, they will feel very quick. So this hopefully will be the beginning of conversations.
Real quick.
Questions
Once they jab you with the vaccination, you're gonna die real quick.
questions for our first two presenters, Senator Omar.
Thank you, Madam Co-Chair. So first question I have is for Dr. Nikolai. Dr. Nikolai is an epidemiologist and professor of epidemiology. Would you be able to speak about the lack of confounders in some of the initial studies that may have caused some confusion about diseases related to vaccine or vaccine-causing illnesses?
Lack of confounders, can you clarify in which studies?
There's this whole concept about autism relationship that in some of the cases that have been brought up. If you can look at it from an epidemiologic eye, and then also subsequent follow-up studies that have actually assessed that further internationally.
Sure. Well, I'm not gonna choose not to speak specifically about autism because in my mind that is an issue that's been settled. Vaccines don't cause autism.
Oh yeah, right.
Scientific evidence.
That's funny shit.
Overwhelmingly supports that association. I'm speaking
Bullshit.
about science, and I'll leave it at that. I will address your question about the rigor of studies that look at vaccine safety. So we assess the safety of vaccines in both pre-licensure trials, right, when there's vaccine candidates not yet approved, and then we do post-licensure monitoring. The pre-licensure studies are randomized controlled trials that by definition are not confounded because individuals are randomized to vaccine or placebo. The comparison groups are identical when randomization works, so there can be no extraneous factors explaining the associations. So there is not confounding in the randomized trials. In the post-licensure studies,
Guinea
and
pigs.
this is what I was talking about before, I didn't have time for it, I'll just take a moment here. We have two really important safety monitoring systems in the US. The first is VAERS, the Vaccine Adverse Event Reporting System. That system, to be very clear, is a signal detection system. Anybody can report what they believe to be an adverse event to VAERS. Parents can report, providers can report, patients can report. So VAERS collects data on people who report adverse events. Those by themselves, right, are anecdotes. For that to become science, for us to rule out things like confounding, we need comparison groups. We need to compare vaccinated people to unvaccinated people to see if the rates of events are the same or if they're different. That's what Vaccine Safety Data Link does. That's a very large collection of health maintenance organizations that have all of the data that you're talking about from the medical records. We can control for confounding by anything that's in the medical record, and that becomes the definitive evidence about the safety of vaccines. So the systems that we have are more than adequate to account for confounding when we look at the safety of vaccines.
Thank you so much.
I hope that answers your question.
Thank you.
Thank you. I know Senator Omar has another question. I'm going to go to any other legislators represented tomorrow. And we'll come back to you, Senator Omar, if we have time.
Thank you so much, Madam Chair. I appreciate you all speaking out today. And I guess one of my concerns is when we talk about vaccines and we talk about the science behind them, excuse me, there's a little concerned when people come to the table, when general public, patients, moms come to the table and they have a concern about the vaccine. Do you think it helps to just dismiss it by saying, this is already proven and I don't want to talk about autism in vaccines?
Ooh.
Directed at me, although
Oh, hell yeah.
And before you do, if I may, I think that what I heard you saying earlier, Dr. Nicolai, is the importance of effective communication and listening with empathy. I did hear you say that earlier, but.
Yeah, so the short answer to your question is no, it's never okay to be dismissive. I said more than once in my remarks that people have legitimate questions and those questions do need to be answered. And now I will defer to the clinician and how to best approach that.
Sure, so I view this moment as what I call an education moment. And so, again, it's never appropriate to be dismissive. People have their concerns, and we want people to bring their concerns to them, because that's how you can discuss and get through those concerns. I think it's incumbent on the scientists of genetics and the clinicians especially to be cognizant of the data, the real data, but also to be cognizant of how data has been permuted. And perhaps fed to social media so that we can respond in appropriate ways to validate concerns and present the data that we know is true. In our minds, we've already come to a conclusion, but I agree, it's our job to be able to promote that and convince others of that.
Thank you, Representative Mara. I think we have time for one more question. If there are any other questions for these panelists. That's right, back to Senator Anwar.
There are some states where the number of people who are vaccinated, children are vaccinated, is much more than the others. Are there new cases of measles? Is there correlation in that situation where we have less vaccination in a community and the measles cases are higher? Is that accurate understanding?
Right, so that's a very good point. The recent outbreak of measles has been highly correlated to areas where vaccine rates are less, as well as in individuals who are less than fully vaccinated. So that is enough to do about that.
Thank you.
Thank you very much. And sure, we do have time for one more. Representative Delphine.
Thank you, Madam Chair, and this is to either one of you. I'm curious, because I think you said earlier that not all vaccines are 100% safe and effective. So with that information, and you did also make the statement that vaccines don't cause autism. And I think that's what you said. You could clarify, but I think you said that. So if you kind of said two different things. One that they're not always safe and effective, and one that they don't cause autism. Can you just give us some, maybe two studies that have are controlled studies, scientific studies that have determined that they don't cause autism?
So to clarify my remark, I said not all vaccines are safe. I did not say that they are not all effective. All of the vaccines that we are using in the U.S. today have proven effectiveness. So they all do work. They're not perfect, but they significantly reduce risk. So I want to clarify that to start. And then, sorry, I want to clarify that. Can you repeat the other part of the question?
I think I was looking for, and just to clarify, I do know several people that have shown no titer visibility at all to some of the vaccines such as MMR. So they're not always effective either in terms of that. But going back to one of my first questions was about autism. Can you name two studies that were scientific control studies that show that, just two. I'm assuming from your statement that there's many.
Did not bring references with me, but what I can say is the evidence that originated the idea that the MMR vaccine causes autism was I can't even really call it a study. It was a case report. There were 8 people in that study, and it was later shown that the data were falsified. The author of it had his license retracted, and the paper was retracted. So that's the evidence in support of it, that basically that evidence was proven to be false and no longer true. Since that time, and Dr. Dekas may be able to say more, there have been something like 28 studies and 3 systematic reviews. I can't quote the exact number, but every study that's been done since that time has not supported the association. Do you want to add to that?
Just to add to comment on your effectiveness question. So certainly when you look at an individual who's vaccinated may or may not have a vaccine response. Okay, so the rate of vaccine response is generally pretty high, but not 100%. Someone may be immunocompromised, we have 100% response to the vaccine. However, the data of science is when you look at a population. So when you view the population as a whole, that's where you see the benefit. So on a population basis, these studies have shown decreased spread of illness amongst the population. But again, an individual, and I think here's the difference between public and individuals that we should grapple with. On an individual basis, there's a risk-benefit ratio. There are risks with vaccines, although very, very small. There are benefits to vaccines, very, very great. But there are also benefits to society. And I think the classic example of that is with COVID vaccine, and I think we all have cases in our own family, perhaps, where someone who had a relatively mild case of COVID perhaps transmitted that to someone who was more susceptible to COVID and had a bad outcome. And so that's kind of moving it from the personal to the public health. And I think it's
Bullshit.
to include that in the conversation.
So I would just add that, several years ago, I think you all know, we removed the religious exemption in the state. We heard testimonies from hundreds of parents, some of which watched their children get vaccinated and go home and be a completely different child. So to say that I think the parents in this room and many parents that were here earlier feel dismissed with regard to the safety factor of vaccines, which you both testified that they're safe, and then I think you said they were effective. So I just wanted to comment on that. And there's dozens and dozens and probably hundreds of doctors, many I spoke to, who have science-based evidence that they are a risk to children, that some of these things have come up. And I know you mentioned, I know which study you're speaking about with regard to autism, but there are many studies out there and many doctors. And I guess the concern is that the government's playing a role in deciding that certain doctors have the science and others don't, because there's many doctors that disagree with the doctors in this room. I don't know if you want to comment on that, but I just wanted to say that because I think the people in this room feel like they want a voice and that they don't have one, and I'm happy to be that voice.
I'm going to ask that you refrain from applauding. This is just like we do in normal public health. We are at the end of our time for this panel. Dr. Dekalb, I'm going to give you a moment to respond, and then we are going to move on to our state agencies.
Sure. So just in response, I think that's an important point. Like I said, there are potential downsides to vaccine. These do need to be studied. Now, the word science is bandied around quite a bit. There's different qualities of science. Okay, so there are studies that can show anything in the world if you look hard enough. And I think the concern is that certain parties may
or if you pay enough.
Smaller findings and elevate that to be the truth, the capital T truth, and basically dismiss the preponderance of data. Now, the scientific method allows for review, reanalysis, and rediscussion as more information becomes available. That's a process that needs to keep going. That's a process that is going. And so I would really encourage that there are, basically you can find studies that show a lot of different things that are not ultimately discovered to be scientifically valid. It's a matter of measuring the quality of the science one way or the other, and ultimately based on the latest data that's available, making decisions balancing public health versus individual rights in this matter. So, thank you.
Thank you, Representative Dauphiné. We need to move on to the next panel, but I appreciate your questions, and I know that there's a lot more conversation. As I said in the beginning, I think we could talk about this for days. And I appreciate Dr. Dekalb, you referencing, I think what Representative Dauphiné is talking about is that we do need and will continue to learn and evolve and understand as the research continues. I think that's a very important point that was raised in that line of questioning, so thank you for that. Next, we are going to move on to our state agency panel. We have with us commissioners from both Public Health and DCP, Department of Consumer Protection. We also have our medical director from Social Services and 2 members of our insurance department. So I'm going to go a little bit out of order than what we have on the agenda.
We will begin with Commissioner Manisha Jutani from the Department of Public Health. Welcome, Commissioner.
Thank you for the opportunity to speak today. We're in a point of reflection about choices that people make for their individual health and their individual health care, and choices that help the public at large. And that's what population health and public health is really about. And as I mentioned in the press conference earlier, there are things that we do in public health to protect our water supply, which may help the individual person, but they help large swaths of the population be safe from disease. We do things to help keep our food safe, issue recalls when foods are identified to be contaminated. These are things that help people stay safe in what they eat and put into their bodies. Vaccines certainly are one of the topics that we talk about in public health, but not the only one. And it is something that helps the population at large, but can also help the individual person. As somebody who had a really bad case of chickenpox when I was growing up, and have seen as an infectious disease physician many older people with very severe forms of shingles, meningitis, or the like, having a chickenpox vaccine for our children, you better believe I have my children vaccinated. Because I've seen the difference. I've seen it as a clinician. I've seen it as somebody who's taking care of people. And I think that's really one of the challenges we're having around vaccines right now, which is that since the 1950s, the advent of so many vaccines that have come onto the market have helped protect generations of people where we have not seen some of these diseases. The MMR vaccine, as many of you know, we have a 98.2% vaccination rate here in the state of Connecticut for kindergartners. And we are one of 8 states which has not had a measles outbreak so far in this country. And there's a reason for that. There's a reason for that in what we've seen in our populace. And I was very sad to hear of a recent case of a child who died in LA as a post-consequence of having had measles many years ago. And they developed a form of encephalitis, which can happen 7, 8, 10 years after a case of measles. And this child probably had it when they were young, maybe even before they had the opportunity to be vaccinated, because you can't get a vaccine before you're 12 months of age. So these are the consequences that people used to see a lot of before. And we just don't see it as much anymore because we do have this intervention in our community. So what we're trying to do as a health department is just provide people with information, ability to make decisions regarding their children and their families, and be able to ground it in information that has been vetted. And I absolutely agree that we need to meet people where they're at and hear where points of concern are. But at the end of the day, we want to be able to be that agency that you can look to be able to help guide those decisions. Again, at the end of the day, the doctor who's taking care of you and your family is going to be the one who really helps you make those decisions. So we want to continue to provide the state-of-the-art public health we've been able to provide in the state of Connecticut, despite the changing federal landscape, and use the tools that we have with our partners to be able to do that. I do want to share just one story of somebody who emailed our department. And this is a quote from this particular woman who says she's a 64-year-old woman who grew up in a family where she was not allowed to be vaccinated. Her mother was a Christian Scientist, did not allow her to be vaccinated at school when other children were getting free shots. And she was barred from even taking aspirin for pain relief, was not permitted to seek medical attention or vaccines. And as a consequence, 2 of her sisters had to be rushed to the emergency department by other parents, one sister with pneumonia and the other with spinal meningitis. And they had already lost one sibling before she was born. So the families that stepped in to help them did it at great risk to themselves. And she was writing to express her gratitude for some of the work that is happening in the state of Connecticut. I understand that's only one person's voice. And there are many other voices here in the room, and I hear you as well. But what I want to say is that we as a department want to provide the resources and options so that people can make those decisions for their families that they see right for them. Thank you.
Thank you, Commissioner. With that, we will go next to Commissioner Brian Caparelli from the Department of Consumer Protection.
Thank you very much. It's a pleasure to be here with the Public Health Committee. We normally are in front of a different committee, so it's good to see all of you in familiar faces. As most of you probably know, the Department of Consumer Protection regulates the 639 pharmacies, the nearly 7,000 pharmacists, and 8,000 pharmacy technicians. So that's our role in what we're talking about today. And so, working in conjunction with the sister agencies, the Department of Public Health, the Department of Insurance, DSS, we issued guidelines and raised some uncertainty as to access to the vaccine. So there has come an expectation of the public that they can go to a pharmacy and get a vaccine if they wish. I don't think that really they think through the mechanics that it's the pharmacist prescribing the vaccine and then administering it at the same time, but the law does allow for that, and that's how most of the time it happens in pharmacies. So, in particular, we issued guidance that says that if you are 18 or older, you can go to a vaccine without an underlying condition and get one. We did this in response to some actions of the FDA, and really in the process of crafting the guidance, we met with representatives of major pharmacies like Walgreens and CVS and Walmart, as well as independent pharmacies and the National Association of Chain Drugs. And their request was quite simple: just provide us with some guidance on what to do in the absence of CDC scheduling or instructions for the latest seasonal COVID vaccine. And so that's what we've done. The best we can do for public health in the state is provide clear and science-backed guidance to our pharmacies, pharmacists, and pharmacy technicians. And they are on the front lines. They continue to be on the front lines of healthcare and vaccine administration in the state. And so while this situation evolves, the agency has issued the guidance that says, in the absence of the 25-26 COVID-19 vaccine administration instructions on the CDC website, which they're still not there as of this morning, the department recommends that the pharmacists use the 2024-25 vaccine administration instructions issued by the CDC. And that guidance expires until they post it, or October 10th. Thus, the pharmacist may continue to administer all FDA-approved or authorized COVID-19 vaccines to any patient who is 18 years of age or older. In addition, pharmacists may continue to administer all FDA-approved vaccines upon receipt of a verbal or written prescription from a doctor or other prescribing practitioner. In short, our guidance maintains the public's expectation of access to safe and effective and most up-to-date seasonal vaccines at their pharmacy, and it creates clarity and consistency for pharmacies and pharmacists in Connecticut, as well as patients in the absence of federal clarity. So again, I thank you, Madam Chairwoman, Mr. Chairman, and the entire committee for having me here, and to our partners in working through this.
Thank you, Commissioner. We know that this issue, it does involve many aspects of state government in terms of the recommendations, the guidance, the purchasing availability and coverage. And with that, we are going to turn to our also visitors from another committee, our friends from the Insurance Department. We have Deputy Commissioner Jared Koski and Counsel Jennifer Dowdy here with us, and I'll turn it over to you.
Hi, good afternoon, Representative McCarthy, Senator Almar, all members of the public health, and thanks for having us today. Similar to what Commissioner Caparelli said, we're not usually our committee, but we're happy to be here and join you all today. And I think what you've heard before is, that this cross-agency approach is effectively three legs to a stool, where you have DPH speaking to and getting to the availability, DCP handling access at the pharmacy, and role of the insurance department is making sure for those who want to get vaccines, they continue to get coverage through their insurance carriers for. I think just a set where there was this sense that if you want to get a vaccine and you go to your pharmacy, you're going to be able to get it. There's been the sense if you get a vaccine, your insurance is going to cover. And that's the role of the insurance department, is to make sure that that coverage still applies to the residents of the state who choose to get a vaccine. The insurance department has regulatory authority over those fully insured health plans in Connecticut. Those are individual and group plans. Roughly, that's about only 25% of the insured population in Connecticut. The insurance department does not regulate self-funded employer-sponsored plans. That's typically, the plan that you get from your large employer. That's regulated and covered by the federal government under the Department of Labor. Nor do we regulate Medicare or Medicaid plans. But these fully insured individual and small group plans under our authority are subject to all state insurance laws and regulations. And similar to the actions taken by DCP earlier this month as part of our role in coordinated efforts among state agencies, the insurance department issued a bulletin. That bulletin affirms the state's interim COVID-19 immunization guidance aligns with existing state laws regarding immunization coverage for fully insured Connecticut-issued health insurance plans. So for those choosing to be vaccinated, the bulletin confirms that insurance coverage is still required from those plans. Many of our residents who want to receive a vaccine, understandably, are deeply concerned over the uncertainty of insurance coverage for vaccines following federal action. So the insurance department remains in close and constant communication with all the major health insurers who have and who offer fully insured individual group plans in this state. Members of fully insured plans voluntarily choosing to vaccinate against COVID-19 are currently covered with no cost share. As with all coverage decisions, the self-funded employers determine their own insurance coverage as allowed under various state and federal laws. Though the Connecticut Insurance Department continues to communicate and have discussions with those carriers who are administering those self-funded plans. I do wish to note that the American Health Insurance Plan recently came out with a statement the other week regarding vaccine coverage, identifying 4 of those self-funded plans. They're committed to maintaining and ensuring access to vaccines. Those health plans continue to cover all ACIP recommended immunizations that were recommended as of September 1st, 2025, including updated formulations of COVID-19 and influenza vaccines, with no cost sharing for patients through the end of 2026. So basically, beyond the plans that we specifically regulate for the insurance companies, we do hear from carriers that are going to continue coverage at no cost sharing for others. We understand that residents are going to continue to have questions about insurance coverage. So as always, our absolute focus is to make sure that we are available to answer those questions. So we encourage anyone who has questions about their coverage or their plans, please reach out to the insurance department. If you are unsure as to whether you have a fully insured plan or self-funded plan, if you're getting it through your employer, you can talk to them, or you can reach out to the insurance department. Thank you.
Thank you very much. Ms. Dowdy, did you want to add anything, or?
I think our deputy covered the topic quite adequately.
Thank you for that. And finally, we have Dr. Jody Terranova, who is here representing the Department of Social Services, I think. Oh, there she is. Okay, on the other side. And as Deputy Commissioner Koski noted a moment ago, in terms of coverage, they do not regulate Medicaid or Medicare. And so this is one of the reasons, again, we thank all of our partners from all different committees, and I know you're usually with Human Services, although we used to see you more in Public Health here. But it's a pleasure to see you, and Dr. Terranova, if you can share the DSS perspective with us, that would be great. Thank you.
Thank you, Representative McMurphy-Vahey. I'm Dr. Jody Terranova. I'm a pediatrician, and I'm the Chief Medical Officer for Connecticut's Medicaid program at the Department of Social Services, also known as SB. We cover almost 1 million people in Connecticut, so the people that are not covered by commercial insurance, we provide coverage for them. And there have been a lot of questions raised with changes at the federal government level regarding coverage and access to vaccines. And we've had providers and members reaching out to us to ask if Medicaid is still going to be able to cover vaccines if there are different changes at the federal level. Back in the summer, when ACIP membership was changing, we started to look internally to see how we could address some of those questions. And I've had conversations with my colleagues across the country, the other Medicaid medical directors, because each state's Medicaid program is a little bit different. As you may know, Medicaid is a partnership between the federal government and the state government. And we have a Medicaid state plan, which is essentially our contract with the federal government, that talks about who is eligible for Medicaid, what services we cover, how we pay our providers, and how we run the program. And if we want to make any changes to that, we need to submit state plan amendments to the Center for Medicaid and Medicare Services and get that approved. And so we looked at the language in our current state plan to see if there were any references that tied our coverage to ACIP recommendations. Because some states are bound to that in their state plan and doesn't provide any leeway if there are changes at the federal level to continue coverage for vaccines that are not on the ACIP list. Here in Connecticut, we're quite fortunate that we do not have language in our Medicaid state plan that is tied to ACIP. So we can continue to cover all vaccines that are recommended by our Department of Public Health, by the American Academy of Pediatrics, by the American Academy of Family Physicians, by the American College of Obstetricians and Gynecologists, and other professional organizations. We have reached out to our federally qualified health centers who provide coverage for many of our members to make sure that they are in a good place with access and to let them know that vaccines are continued to be covered through Medicaid and that they should not be seeing any barriers at this point in time. One question that we'll have to work with our partners at DPH about would be if there's any changes to the Vaccine for Children program, because all of our vaccines for children on the Medicaid program are funded through that federal program that's run by DPH. And so we'll need to have conversations with DPH, with our legislators, to figure out how to fill that gap when the time comes that there will be changes to vaccines covered through VFC. So I'm happy to answer any questions about the role of Medicaid and access to vaccines today.
Thank you very much. And as I said earlier today at the press conference, today's conversation really is a point in time. Some of the federal conversations remain in flux, as I think Commissioner Caparelli referenced. There is some guidance still missing. We're waiting for final sign off. So I think we will need to continue to be in conversation here as legislators as we go forward. So we recognize that you are agency partners across multiple committees and agencies are working together closely. We anticipate that we will need to continue to talk with one another and our colleagues in other committees as well. With that, are there questions, Senator Omar?
Thank you, Madam Co-Chair. I'm going to be asking this question for the next panel as well, and Dr. Markowitz, you'll probably be, maybe you can address this, but there clearly is a group of vaccine hesitant families, and they're having difficulty getting pediatricians to see their children. How do we manage the rest of the health issue, and how, I recognize the fact that you have immunocompromised patients in pediatricians' offices and you're trying to be proactive, and I think you have Dr. Terranova, you dealt with some of this as well in your previous role. What can be done at the state level to help make sure that there's access to individuals who are vaccinated in pediatricians' offices?
Would you like to direct that to Commissioner Tutani?
Commissioner Tutani and Dr. Terranova.
So obviously our goal is that everybody can access care and have a reliable provider who can meet people where they're at in terms of answering their questions, because that's really at the end of the day what's going to help people make those decisions best. We can't force any of our providers to do things outside of what they want to do, But what we can do is work with providers to try to have their information known and out there. And part of our role is also the regulator of providers. So we are the group that licenses providers. And so we do have to ensure a certain amount of safety of what our providers do in the state. That's part of our role. But at the same time, give them the opportunity to practice in a way that is consistent within the scope of what we license them to do. So I think it's a little bit of a challenging role for the Department of Public Health because we are the regulator of people in your licensure category and of facilities, but at the same time, also an educator and helping people have information. So I think we really allow practices to do what is within their scope and what is in the boundaries of what they are licensed to do. And that's part of what we have to be able to regulate, but also understand that we need to try to find providers that are going to meet them where they're at. But I think Dr. Turner really have more of a discrete example as a pediatrician who used to work in the community.
Thank you. Senator Ingle, that is always a struggling question for pediatricians. Because there are many pediatricians that want to be able to run their own practice the way that they see benefits, caring for their most vulnerable patients and protecting them and ensuring that all the people around them are vaccinated. It does then create this dichotomy of patients that struggle to find a provider that can provide other aspects of their care. A trusting relationship between a provider and a patient is essential. And so I think some providers think if their patients can't trust their advice on vaccines, perhaps they don't have that foundational, trustworthy relationship. We do know that there are many providers in the state that will take all patients, including our federally qualified health centers. So there is a safety net of providers around the state that will take patients if they're vaccinated or unvaccinated. And those are in all areas of the state. So that is available, and that's something that we continue to ensure that we have Medicaid providers that are across the state that will take patients whether they're vaccinated or unvaccinated. I think one of the other challenges is that when patients are not able to see a provider that will continue to have the conversation with them about the importance of vaccines, they never have the ability to really continue the conversation and perhaps change their mind or make a different choice. And so it's almost like that choice is really predetermined if they're often segregated to providers that will not have the conversation and will just continue to allow them to be vaccinated. Thank you.
Thank you, Senator Almore. Senator Summers.
I think it's more of a comment, but, and I guess I would direct it to the commissioner from ECH. Is I've heard you say that, our goal is to make sure that we have resources and options in the state of Connecticut. And I'm really struggling with what those resources and options are for those who are vaccine hesitant, because we've managed to change the schedule so their kids can't attend school if they're not fully vaccinated. We have the same issue with pediatricians. I hear repeatedly from folks, and many of these folks are hesitant on one vaccine, by the way, not a whole gamut of the 72 that are required. And they may, just be upset about or concerned about the flu shot at 4 years old or whatever it is in here. So what are the options and the resources for those families? Because there's a lot of them. We've had 10,000 of them outside on the green the day that we were passing this vaccine, bill that took away the religious exemption here in the state of Connecticut. I just don't see the resources, and I'm hearing from the medical clinicians that are here. Maybe we need a CME requirement on how clinicians talk about vaccines to patients, because I know personally many doctors that they give up on the patient and they don't want to have the conversation with them. And now that patient is looking for someone to take care of their kid when they have other issues. And not everybody lives close to a federally qualified healthcare center. So I'm concerned about what those resources and options are. If we're talking about the public health, the bigger benefit of public health, what those options are for those families that have vaccine hesitancy. I'm also concerned when we heard information about Medicaid reimbursement. what does Connecticut look like? And I don't think we have the answers to that. But if we decide that we're gonna create our own Northeast Regional State, so to speak, or collaborative, which we have never done before, we've not done it when we had a pandemic, and we differ from what is coming out of Washington, I think we would be better off trying to mend that relationship rather than going off on our own and creating our own Northeast CDC, so to speak. What happens if the guidance is different? And what does that look like if the federal government decides, well, you guys can do this, but you're gonna be federally and financially penalized? Have you thought that through? I have a lot of questions. I'm gonna be sending them to you in writing because I don't want to take up too much time, but I'm very concerned about that. I'm also concerned about the fact that this collaboration, you have New York, you have all these different states. Things in New York City may be very different than rural Connecticut. So if a decision is made and Connecticut doesn't agree, how does that work? Is your decision binding? Is there public input? How do we make sure, we talked about communication, that our entire state understands what's happening? And I think those are a lot of questions that haven't been answered. And I will obviously be sending, I have a long list of questions. But I am really concerned about that when we talk about the resources. And, we may not all agree on vaccines. I do believe in vaccines, people know that, but I also believe that people should have a choice on, what they think is okay at an appropriate time for their child after they make an informed decision. So I think there's also, now that we have formed this by the governor's decision, this regional CDC, there's a lot of concern I've heard from people, because when we passed that vaccine bill, it gave you, the commissioner, the authority to add any vaccine you want to the list. And I think that's very concerning for people. So that was a concern then. I know it's continuing now. It's bringing its like ugly head up again. So we're going to have that conversation. So I would just like to say that if we're going to have these forums, and this is not a public hearing, it's a forum. That's why people from the public can't speak. That we should do more of them, and we should have differing opinions at this table, so that we can have a fully robust conversation about where we are. So I want to make sure that.
Thank you, Commissioner Giussani.
Thank you very much, and I appreciate your questions and comments always, Senator Summers. As you know, I responded to your letter about the collaborative already, so I want to reiterate some of the comments that I made in that letter and that I made in the press conference earlier today. We are not forming a regional CDC. The United States of America is a union of states. Our obligation is to the residents of the state of Connecticut and the statutory responsibilities that we have to our state and to the federal government. We never had a bureaucracy above us other than the federal government before, nor do we have any desire to have any other sort of bureaucracy going forward. So to be clear, we are not forming a regional CDC. There are states that have publicly said that they are part of the Northeast Collaborative. There are states that are collaborating with us who may not have said it publicly. We work as a region, and even with states across the country, and not just on the coasts, throughout the country. That is part of our role in public health. Our role is to try to protect as much of the public as possible. And we are doing that right now by working on guidance that we all agree upon, that we can put out. Beyond that, we don't have other things right now that we see as challenges that we need to address. But by working together and collaborating, which we have always done that. States throughout the country always do that. This is an enhanced version of that because we have more changes coming on a regular basis. So how we navigate those changes are part of what we're doing right now. So I want you to be rest assured that we are not forming any regional CDC. We have no desire to form a regional CDC, but we will work with colleagues to take actions to help provide access to public health measures necessary in our state. Not mandates, access. That is what we are working on as a department.
Thank you, Commissioner.
I just have a follow-up to that really quickly. So you were saying that your collaborative will not give mandates, it will give guidance. My question is, what if your collaboration collaboration that Connecticut will now follow X, Y, and Z. You say it's guidance, but everybody here who's been on public health for a while knows that guidance turns into mandates. That's not the right time. So I'm glad that you said that publicly. I will continue to follow up with my follow-up more detailed questions concerning that. And I'm just very concerned about the differential of what this collaboration may come up with, again, with the different states, with different populations, and different densities, versus what our federal government may be coming out with.
So I would like to have a moment to respond, if I may.
Briefly,
which is
if you would.
Sorry, briefly, which is that this is a moment in time, as Representative McCarthy-Baby has said right now. And as Dr. Terranova mentioned, the childhood vaccine schedule is something that is determined by the DPH commissioner. That has kept our children safe in the state. That is something that we as a state have believed in so far. If there are going to be additional changes coming from the federal government, that is something that will have to be robustly discussed by the legislature and the governor's office going forward. But as of now, that is where we stand in the state of Connecticut.
Thank you, Commissioner. Representative Claridis Teacher, and to be followed by Senator Marchand.
Thank you, Madam Chair. Thank you, Commissioner, for your comments. I'm just, to go off what Senator Summers said, you stated that this collaborative will be multi-states discussing whatever health concerns you have. But to the general public, if something comes down from the CDC and they're telling the state of Connecticut, this is what we want you to follow, now you have the option to say, no, we don't want to follow because the collaborative states something different. Is that correct?
That would be incorrect. Each state gets to make decisions for themselves. It has nothing to do with what we as a state decide to do. Just also to be clear, the CDC is not a regulatory body for any state. As we saw in the pandemic, the CDC made recommendations and every state decided to do what they wanted to do. The same would be true here. What the collaborative is offering is, let's have an opportunity to see if we all agree on certain things. But at the end of the day, each state's responsibility is to the residents of that state.
Thank you, but the state of Connecticut does typically take the recommendations of the CDC. So this is our way to say, okay, we don't agree with what they're saying, and we're going to make our own decision. I'm just saying, if we don't agree with something in this building, we make a law to do whatever you want, and that's exactly what you're doing. You have the authority to change the vaccine schedule, which is what, and you have the authority to also talk to anybody that you deem necessary to help you with those decisions. Thank you, Madam Chair.
Thank you. To change the schedule or to keep it as it has been for a period of time. But I think, again, I will continue to emphasize this is an evolving conversation, and I think it will be important for all of us to remain in conversation. Representative Kaufman, I think will probably be our last question. Oh, I'm sorry. I forgot my good co-chair. I didn't say that out loud. Senator Anwar and then Representative Dalton. Thank you for reminding me. This is why you're good coach.
Thank you so much, Mr. Chair. I tried to do my best. Just another thought I just wanted to present in the question. I think one of the conversations around collaborative has been that if the group of states come together to buy vaccines or any other products, there's a financial benefit for that. I think there's value in some of those conversations as well, but that's theoretical. That's what people have talked about. My question is on clarification on the insurance part. There's first and foremost, it's important to understand that there is no mandate of the COVID vaccine. But there are a lot of people who have lost their loved ones or have loved ones with immunocompromised status, and they're interested to get the COVID vaccine. They will not fall into the CDC criteria of the past or perhaps the future. And they want to get the vaccines, but is it fair to say, based on our conversation or your points earlier, that if they are outside of the CDC recommendations and they're adults, they should be able to get the vaccine and be paid for by the insurance?
Correct. So our laws make reference on the fully insured side to individual and group plans. And those vaccines that are recommended by a number of bodies, including ACIP, but other bodies as well, are required to be covered by those fully insured health plans at no cost. Our bulletin reflects that practice will continue. It will continue on through this calendar year and into the next plan year for 2026. We've also heard from the national carriers, one of the benefits of being in Connecticut is that we are home to many national health carriers, and we have the conversations with them. So those plans that are not regulated specifically by the insurance department, that are those self-funded large employer plans, what we've heard from the carriers is they will continue for this year into 2026 as well. Those prior recommendations for which coverage will be provided by the insurers at no cost share. So what you've had with regards to coverage is going to continue.
This is very helpful. And just to follow up, if the ACIP recommendations are approved by the CDC, is there going to be a change in that?
Not right now, no, not into 2025 or 2026.
Thank you so much. This is very helpful. Thank you, Madam Chair.
Thank you. Representative Delphine will be our last question for this panel.
Thank you, Madam Chair, and I have a couple of comments and a question, starting with the Commissioner of Public Health. I know you said that one of the things you wanted to do is provide choice, but I don't think the people in this room believe that they were provided choice with regard to having to choose between giving their child something that went against their religion and going to public school. I just wanted to say that. You also said that vaccines have been safely administered in the state, and there are dozens, if not hundreds of people that we heard testify that saw devastating changes to their child after being vaccinated. So I would argue that that's the parents in this room and many in this state would disagree with you there. And my last, which is a question, I want to know, what is the purpose of having this multi-state coalition? I still have not gathered that through this group. You're saying that Connecticut can make their own choices. So why do we need to join with other states? I still don't understand that.
Because we are dealing with challenges that we haven't dealt with before, we're learning from each other how each state has navigated things. So as an example, in certain states, you could have standing orders in pharmacies to be able to administer vaccines. In certain states, you have the ability of a health commissioner to be able to make certain statements or put certain things in place to allow for access. That type of thing varies state to state. And as we learn how each state manages these challenges, you heard about the challenges around pharmacies or insurance coverage. Every state is different. But when you learn what people are faced with in terms of the challenge in their state, you can start tapping into the resources you have within your own state to be able to figure out how to answer those challenges. So I appreciate many of the comments and what we've heard so far in the room today. What we're not hearing is all the people we're hearing from that are saying, I'm being turned away. I can't get my 17-year-old vaccinated and I'm walking into a pharmacy and trying to figure out what I need to do. We have more of those kinds of emails that are coming to our department, and those are the kinds of things by talking to each other, we can help navigate and figure out what we are going to be able to deal with going forward. Also, I would say that we have seen many changes over the last year, and we are planning for what the other potential changes might be by brainstorming together in advance. When problems do arise, hopefully we won't be flat-footed in that moment, because that's the point at which we need to respond quickly. So when we have $150 million cut, the day that we find out is the day after the grants were cut, and it's only through the efforts of the governor's office and the attorney general's office that those funds were flowing again. When we're otherwise having to think about cutting off local health contracts and saying, I'm sorry, the work you're doing in your communities has to stop effective immediately because they've been cut, with a little bit of planning and a little bit of time in advance, which we do try to leverage as states as a whole, that's what we can be prepared for going forward in the months ahead.
Thank you. So your collaborative won't include physicians that have concerns that the parents have expressed with vaccines? that there won't be any of those individuals in the collaborative. Is that true?
Every state has their own laws as it relates to those questions. And so every state has to manage that on their own, and I respect the legislature to be able to address the issues you brought forward.
Thank you, Commissioner, and thank you, Representative Dauphiné. There are a lot more questions, and I do encourage legislators, if you do have questions, please reach out to our agencies. Certainly, we're happy to collect those as a public health committee as well. It's a great opportunity for us to thank both Lily Henry and Peter Kolakowski for helping us put this forum together. And with that, we are going to move on to our final panel, which is our practitioners, the people who are on the ground. And I appreciate the Commissioner highlighting one of the reasons that we did this forum is because there were a number of questions coming in from constituents, from legislators about issues around coverage, access, etc. So today, we'd like to hear from our practitioners what they're seeing on the ground and the questions and concerns that we may need to be thinking about as well, both as agencies and as legislators. With that, I'll turn it over to Dr. Molly Markowitz.
Thank you so much for the opportunity to speak today to the forum, Representative McCarthy-Davey and Senator Anwar. I also wanted to take a moment to recognize all of the parents in the room, caregivers, as well as caregivers and family members that may be listening. Because as pediatricians, we value so much your opinion and your perspective and your experience. And really that's one of the most important things to us. And we want to encourage all of you to, if you have questions or concerns about vaccines, to talk to us. We want to hear from you. We want to talk about it. We want to hear your experiences and concerns. In terms of where things lie currently, I wanted to speak in the context of some of the information that federal officials have been sharing currently regarding vaccines as well as autism, because there's been a lot of false information, confusing information, and dangerous information shared. In this context, the American Academy of Pediatrics has decided to publish an independent vaccine schedule that is based on rigorous scientific process that they feel has been currently undermined. In terms of the Connecticut American Academy of Pediatrics, given the confusion in the current state of affairs, we wanted to share some statements that we strongly support and affirm. We wanted to start off by saying that vaccines are safe, they're effective, and that they save lives. The components of vaccines, including adjuvants, stabilizers, preservatives, have been extensively studied and been shown to be safe. Specifically, there are questions about aluminum salt, which is an adjuvant in vaccines, which has been shown to be safe. This aluminum is a naturally occurring substance in our diet, and in fact, children are exposed to more aluminum through breast milk or formula in the first 6 months of life than through vaccines. A lot of questions also around mercury or a preservative called thimerosal. This is a specific type of mercury called ethyl mercury that has been shown to be safe. However, it has not been used in U.S. childhood vaccines since the early 2000s. The AAP's new vaccine set schedule, which is backed by scientific evidence and expert consensus regarding safety and efficacy, does continue to recommend universal COVID vaccination for children 6 months and older till 2 years old.
Bullshit.
It additionally recommends risk-based vaccination for 2 to 18 years old, meaning if your child has a medical condition that may make them more likely to get seriously ill. As well as preference-based vaccination. So if a parent would like to have their child vaccinated, they can do that as well. The schedule continues to recommend measles, mumps, rubella, and varicella vaccination in 2 methods for children under the age of 4. The first method is 1 shot, and this is a combination of measles, mumps, rubella, and varicella, all in 1 shot, and it is commonly known as MMRV. Additionally, there's a second method where you can get 2 shots. The first containing MMR, measles, mumps, rubella, the second being only varicella. The AAP recommends discussing the risks and benefits of each method with parents, and utilizing parental preference on which way they would like to have their child vaccinated. Additionally, it continues to recommend that hepatitis B vaccination be given within the first 24 hours of life. This is to prevent infants from infection. If infected, 90% of infants will develop chronic liver disease, which can lead to premature deaths. Hepatitis B is transmitted through blood and other bodily fluids, with potential transmission happening during labor and delivery. However, it is a highly contagious virus that can be transmitted while caring for an infant after birth. Therefore, it is critical that infants receive this vaccination early to protect them both during delivery as well as early on. Decades of research have found that there is no scientific evidence to support that vaccines cause autism. Further, there is no scientific evidence that giving vaccines individually decreases the risk of developing autism. The cause of autism is currently unknown. It is thought to be multifactorial and increasingly linked to genetics. If families have questions or concerns about vaccines or the causes of autism, I please encourage you to speak to your trusted pediatrician. For children with autism and to their parents, pediatricians are committed to supporting their growth and development and expanding opportunities for them to thrive. Moving forward, it is critical for Connecticut officials to provide families with scientifically rigorous information. The new AAP vaccine schedule is posted on the AAP's website, as well as a fact check page where individuals can learn more about specific topics. The Connecticut AAP is eager to continue to work with community and state officials to help ensure that Connecticut's children continue to have critical access to all of the vaccines recommended by the evidence-based, scientifically rigorous AAP schedule. Connecticut currently has one of the highest vaccine rates in the country and has strong school entry immunization requirements, which is a critical tool to help ensure that Connecticut's children continue to stay healthy. Thank you for the time to speak today, and I look forward to hearing your comments as well as answering questions.
Thank you very much, Dr. Markowitz. Next, we will go to Dr. T. Biersa. Welcome.
Thank you so much. Senator Onward.
You can press the button to speak so we can all hear you. Thank you so much.
Can you hear me now? Thank you very much. Senator Onward, Representative Garfield, elected officials, state officials, dear colleagues, and community members. I speak today on behalf of Hartford County Medical Association with a deep and urgent concern. The current vaccination controversy has sparked a crisis, one that is touching every corner of our healthcare. Its impact is being felt not only in our exam rooms, in our physicians' offices, but in the hospitals and around the kitchen tables and within families throughout Connecticut. For physicians, this moment has brought an extraordinary burden and mistrust. Every day we spend more time addressing fears, untangling misinformation, and working to rebuild the trust. Instead of focusing fully on healing, we are drawn into emotionally charged, deeply personal conversations, the conversations that are vital, but time-consuming and draining. The controversy threatens to increase the spread of preventable diseases, leads to missed opportunity for care, and place even more strain on an already exhausted and overburdened healthcare system. Many of my colleagues tell me they feel stretched thin during their work hours, and yet they continue to show up because at the heart of medicine lies a promise to care for our patients no matter what the challenges are. For our patients, the effects are just as profound. Parents are confused, torn between conflicting messages. Families face fear and frustration over decisions that should provide peace of mind. In view of the controversy, some will delay the care, others will decline interventions that could protect themselves and their loved ones. Tragically, the result is going to be more illness, more suffering, and worse health outcomes in our communities. Behind every statistics is a person, a child, a parent, a grandparent, a family member, and our neighbor. Someone who deserves clarity, compassion, and very best that medicine has to offer. This moment has eroded trust. It has created frustration and confusion. Physicians and patients, and among families and communities. As the president of Hartford County Medical Association, I stand with both our medical professionals and patients we serve. We remain committed to advocating for policies rooted in science, not shaped by political divide. We will continue to deliver clear, reliable information to families based on scientific evidence. And we will always prioritize the
Bought and
health
paid for
well-being
scientific
of our
evidence.
communities. Let us remember, behind every vaccine, every patient, and every physician is a shared hope for a healthier communities and healthier tomorrow. That is the hope we must protect and carry forward, and I urge the legislators to please. We need to find the resources to have people on both sides of the aisles. Those who are pro-vaccine, they need help, and those who are against the vaccines, they should be provided the means and ways so that they can get the proper care for their children and educate their children in the schools. Thank you so much.
Thank you very much, Dr. Mirza. Next, we will hear from Dr. Ray Lorenzoni. Welcome.
Thank you. Thank you very much. I appreciate being part of this panel. My name is Ray Lorenzoni. I'm a pediatrician and pediatric cardiologist. I was born and raised in Connecticut and went to school in Connecticut. I have a lot of commitment to the state, and I appreciate everyone who's here. Personally, I grew up in a family that raised me to be skeptical of aborting. And so I certainly appreciate many of the voices here today that are concerned and raising those concerns. On the other side, with my training as a physician, I'm a little bit unique in that I can bridge the divide from some of the old school vaccines when I was first born and given, and some of the additional vaccines that have been given since then. In addition, with my medical training, I've understood that practice has changed, and the number of diseases that we've seen over time has significantly decreased. Working on the ground level as a trainee, I was doing spinal taps on 2-month-olds and 1-month-olds, and that no longer occurs by and large. A lot of the meningitis that we saw, a lot of the early, whooping cough and Haemophilus that we used to see before the vaccines were common, no longer occur. And we no longer have to do these, pretty significant procedures on babies to make sure that they're not going to get sick, let alone babies who do get sick and have these kind of outcomes that we all fear. I'm a supporter of vaccine because I've seen both on the ground level and based on my training that these vaccines really provide protection and have really changed the practice of medicine in ways that many people don't even know nowadays and don't see. I just want to make those kind of personal comments to know that we're not all the enemy here as providers. We're on the ground level. We're the ones responsible to our patients. We're trying to hear you out. We want to work with you. We want to provide good information. And when we disagree, we want to disagree respectfully and hope that we can kind of continue that conversation. So I appreciate this forum, and I look forward to any comments or questions. Thanks.
Thank you so much, Dr. Lorenzoni. Next, Dr. Ulysses Wu. Welcome.
Thank you for allowing me to talk again. I appreciate everybody that is actually here and listening. I do appreciate all points of view. And I'm just going to echo, I'm going to keep this short and echo what has already been said. What you've heard so far is the key words: science, choice, community, safety, access. It's this amalgam, it's this, I don't know if you all remember the children's book, Stone Soup, right? All of these are ingredients that make what our village is, what our community is. When I spoke earlier, I talked about the microscopic beauty that we have within our institution, our community. I believe in the science, the beauty of science. I believe in the beauty of safety. I also believe in the beauty of choice. And we have to figure out how to bridge that and how to understand that. How do we partake in this stone soup that we are creating for everybody? And I think that's actually very crucial, because if we all go our separate ways and we don't figure out this bridge, then we'll never hear each other's voices. There's no doubt that I believe in the science. We've talked about preventable disease, and the saddest thing is seeing disease that occurs that was preventable. And we're not just talking vaccines, we're talking motorcycle riders that don't have helmets. We're talking car accidents, people who didn't wear seatbelts. A lot of different things, some of them very polarizing. But as a practitioner, I trust in the science. I trust in what we have to do, whether people may not be aware, to try to continue our course of this beauty of preventable disease. And hopefully one day we'll get to that point where we can all partake in this stone soup.
Thank you. I always appreciate a good reference to a children's book, so thank you for that. And finally, we will hear from Dr. Michael Barada.
Thank you. I am last and hopefully one of the shortest, but thank you to Representative McCarthy-Beatty and Senator Anwar for allowing me to be included in this forum today. I am an infectious disease physician by training. I'm here to represent the Connecticut State Medical Society, but as a clinician, I let people know that almost on a daily basis, I am in conversations with my patients regarding vaccines. And the main thing that I wanted to convey today, and I heard a lot from the discussion, is the communication with patients and how best we could do that and what resources are available to individuals. So I think it also covers the topic of vaccine hesitancy, which I see on a daily basis when I go through a list of vaccines that my patients, or primarily immunocompromised, we need to find a pathway that will allow them to live at least as normal as possible. So vaccine information is something that we provide to each individual when they come to our clinic and they receive a vaccine. And information campaigns can influence vaccine attitudes, not only for the individual, but for the community. If they are tailored communications, they may be able to reach more high-risk populations, as well as the vulnerable populations. And clear messaging that will minimize any confusion and recommendations from different sources might be effective. I think it has been quoted and mentioned that vaccine hesitancy is a spectrum, and it's not one size fits all. As such, vaccine recommendation communication should be evidence-based, and our organization is fully confident behind the decades of science and on the safety and effectiveness in developing immunity against preventable diseases and the positive effects it has on public health. I'll give one recent example, is the recent epidemic on mpox. And that epidemic was stemmed by the use of vaccines to the vulnerable population. Messaging may be context specific and needs to be culturally appropriate. We need to reduce any signs of stigma, and it must be tailored to the individual's position on the vaccine hesitancy concern. By engaging with specific groups based on their concerns, discussions may be more focused and are more likely to be productive and less confrontational. These can be covered by their doctors, and it can help to build that caregiver trust that we all talk about. Provider recommendations to vaccinate is one of the key drivers of vaccine uptake, and something that physician-led services can accomplish. Identifying sources of confusion in vaccine delivery may arise from the faulty guidelines, logistical inconsistencies, and the spread of misinformation. Frequent changes to the guidelines that include determining who is eligible, who are special populations, who needs a booster, can sometimes lead to confusion, not only for the public, but for the professionals as well. And finally, a strong community engagement and the use of vaccine champions has been a valuable strategy in many settings to address vaccine hesitancy. Alongside communication campaigns and evidence-based interpersonal communications, we are in strong support of the programs that are promoted by the Department of Public Health and the legislature, and that is clear and implemented well. Thank you for your time.
Thank you very much. I appreciate all of you as providers, and I probably should have said this earlier to all the panelists who have taken the time here today, especially to you providers who are not seeing your patients today. I know we have some questions for you as panelists, and I'll start with Senator Anwar.
Thank you, Madam Co-Chair. If we just looked at what's happening on some aspects of the vaccine hesitancies, it's quite clear that a lot of communication through social media at times, it leads to narrow casting, and everybody starts to understand things from the areas and the places that they're listening to or the people that they're listening to. That's pretty strange and dangerous recipe for a lot of other medical misinformation that may happen. And with the AI and a group ability to try and create many of these videos in a matter of a few minutes, and hundreds of them can be created and then start to go into people's boxes. This is a recipe for disaster around healthcare and around misinformation around healthcare. Is the medical community, physicians, clinicians, ready for what's going to happen with everything else? This could be the first step of creating pockets of information or selective information. What can be done about this? Anyone?
I can touch on that background remarks if you want. As physicians, I'm in practice for a number of years, not as many as some here. But we've been speaking with patients who are informed from sources as varied as Google and WebMD and Medscape and actual medical literature. And we encourage patients to come in with questions. I don't think any physician here would want a patient to be fully uninformed when going into procedure, right? That's the large majority of what we do on a daily basis. In addition to the medical testing that we think about, the diagnostic kind of avenues that we consider, counseling our patients and making sure that they understand where we're coming from and why we've arrived at the decision that we make is super important. And so the amount of information that's going to be coming from quote unquote non-professional sources is going to be concerning. I think as a public and also professionals should keep that in mind. There's a number of studies that talk about how if we hear something 3 times that align with our beliefs, we're much more likely to believe it. And with the volume of information coming from all different types of sources, we're going to hear hundreds of things in one direction or the other. And so, as has been mentioned in the past, if we ask a very specific kind of leading question of the internet, we're going to get the answer that we're looking for, whether or not that answer is actually accurate. And so I appreciate the question, and I think we all need to just be aware of that. And as physicians, with our background in how to address kind of varied information and also knowledge of what is known versus what is unknown, it's very important to kind of trust the professional that you've chosen to trust, right? At least when you're coming in to see your physician and they're giving you guidance, I hope that people can understand that we're coming from the best place that we can, even with limited knowledge. Thank you.
Dr. Markowitz, did you respond?
Yeah, thank you for your comment and question. I think I would encourage any parent or individual who has questions about something that they hear or see on the internet to talk to someone they trust, their trusted pediatrician or trusted physician. Again, we want those questions. We want to talk about what people are hearing and experiencing and seeing, and we can then provide our perspective and experience to help families or individuals make healthcare decisions. In terms of some of perhaps the strengths the American Academy of Pediatrics is very active on social media, and there are pediatricians who provide evidence-based, expert consensus information and recommendations on social media, so it can be a great place for families to get accurate information as well, because the reality is we all spend a lot of time on social media. So I think that there are challenges, but also some strengths that are present as well.
Thank you for that. The majority of Americans do get their news through social media, which is one of the reasons we have talked here about how we're communicating these public health messages. Whether we like it or not, we all will need to continue to do so. I have a follow-up question actually for you, Dr. Barada. You talked about the fact that vaccine hesitancy is on a spectrum, and I think that's really important. Also important in terms of the communication and the recommendations should be evidence-based. Now, I don't think what you meant was based on the evidence and the science in terms of the process. Correct me if I'm wrong, but the style of communication, I'll give you an example. I'm a social worker. For many years in substance misuse treatment, we talked about interventions, and we learned over time that that process was not as effective, and in fact, the move to motivational interviewing as a tool to be able to effectively help people seek that treatment. It strikes me that that's a similar type of skill that would be needed, one that we perhaps learn in social work school that you may not have time to learn because there are so many other things that you have to do as a provider. But can you speak to specifically what some of those evidence-based strategies are in terms of communicating with those who are vaccine hesitant?
Thank you for that question, but I think you've answered it. And so some of the evidence is around developing skills in motivational interviewing, which is something that needs to be developed, and people need to be trained in doing that because it's a very special technique. But it has been shown to be effective in addressing vaccine hesitancy.
I was hoping you might add some other ones, but I guess that is something that, can you just speak briefly about what motivational interviewing is and how that works?
Well, I think it's developing a sort of a panel of questions, basically, and trying to understand where the individual is coming from and what sort of things might, for example, be a barrier for that person to be seeking or not wanting to get a vaccine. For example, if we're just talking about vaccine hesitancy. It's an ongoing process. It's not something that can be done in one session. And there are other techniques that you can do. I mean, people can talk about incentivizing folks to do things and things like that, but I think the basic things about that is that it addresses sort of the individual needs, not only in substance use, but in other fields as well.
Thank you for that, and to your point, it takes time. Dr. Mirza, I was struck hearing your comments about the burdens that you all face as providers in terms of time and also the billing cycle that is a part of it as well. I believe someone else had a question. I don't know, Representative Dumpany.
Thank you, Madam Chair. And again, I have some comments and then a question. And I do appreciate everybody being here today and the opportunity to ask some questions. I just wanted to point out that there is only one side in this room. The opposing views are not sitting in this room except for maybe our audience, but I did want to point that out, and they will come with evidence-based science as well. When I asked about a study, I couldn't get a study that talked about disproving that perhaps vaccines cause autism. I'm not saying they do or don't. For those of you that don't know, I do come with some authority because I am a nurse. So I have worked many years in the medical profession, and I'm very familiar with what an authentic scientific control study is. I wanted to say, I think that Dr. Markowitz, you said that the vaccines are safe and effective. We had Dr. Nicole, please forgive me if I'm not saying these words correctly, or your name, said that they weren't 100% safe and effective. We know that for everything. If you take out a bottle of Advil or baby aspirin or whatever it is, it doesn't work for everybody because, as Dr. Wu said, one size doesn't fit all. We all have different DNA, and how we react to things is very different. So it's not safe for everybody. And we have people that have no effectiveness from many medications because they're not effective for everybody. That's why we have dozens of treatment plans. We have dozens of doctors that have different opinions, and that's why we seek out a second opinion. And when I'd like to speak to the adjuvants, I think you mentioned that they're safe. Well, you were talking about ingestion. These adjuvants are injected into our bloodstream, and they pass the blood-brain barrier. And so that's a very different kind of method, if you will. So when we talk about breast milk, yes, I understand that. But we're talking about mercury and thimerosal, aluminum salts going through your bloodstream into the blood-brain barrier. Now, I'm not going to sit here and debate whether vaccines are bad or good. I'm just saying that there's an argument to be made, and if you listen to many of the parents that have come out and spoken out about what they saw with their children, they're not safe and effective for everybody, so there's concern. And I think some people have spoken about choice, and the parents in this state don't feel like they have a choice. They don't feel like they have a choice. The choice is they have to pick the medical treatment that their religion doesn't support, or they don't get to send their children to what's afforded to every other family in the state for public education. But my question is to Dr. Markowitz, could you share any studies, even just one, that's been performed with vaccines that has been a vaccinated child versus an unvaccinated child? Because I think earlier Dr. Nicole, I mentioned that, but I haven't seen those. And then just one other comment about the research. I know she spoke about, I think you were rather dismissive, Dr. Nicolai, with the parents in this room who have done tons of research. And I wouldn't try to equate it to any medical person, but they know what they're talking about when they come and they talk with authority. But thank you, and if you would answer that question, thank you.
Thank you so much for your comments and question. Would you mind if I responded to your comments as well first?
I just had that question. No, not necessarily, but I mean, that's up to the chair.
I welcome if you have comments and reflections, and certainly would ask that you answer the question as well.
I very much appreciate your comments. I think when the American Academy of Pediatrics says that vaccines are safe and effective, that is based on the vast majority of individuals, of course, and that's what we do every single day as a pediatrician, is we meet individually one-on-one with a family and discuss the individual risks and benefits and think that through. And you are right that for some patients, some children, that certain vaccine may not be safe and may not be effective. So that is true. However, it is also true that vaccines are safe and effective when we think about them from a population perspective, as well as the vast majority of children. And that's a discussion that I have every day with families. In terms of the safety of certain components of vaccines, so you described specifically injection versus ingestion of a certain substance. I wanted to just clarify that when you ingest a substance, it does go through your GI system or your stomach and intestines, but it does end up in your blood system as well. In terms of safety and efficacy, there's been extensive studies looking at the safety and efficacy of the ingredients, and in addition to the studies, experts have then reviewed that evidence and made recommendations through the FDA on whether or not vaccines are safe to be given with these ingredients. Of course, we are always, as a medical community, as a scientific community, reevaluating, restudying, rethinking. And if you look at people who practiced medicine years ago are practicing it very differently now because we know more. And we make the best possible decisions we can today with the information we have. In terms of your specific question, I would be more than happy to provide you with specific studies in whatever format you would prefer, email, phone call, in-person meeting after this hearing. And I'd love to discuss them with you. I don't have them here with me today, but I think that speaking to the research in general, there is extensive research supporting the safety and efficacy of vaccines.
Thank you. I appreciate your answers, and I would say that there's a huge difference between an injection and ingestion. We learned that in medical school, so there's a huge difference in how it passes to the brain. But thank you so much for your responses. I appreciate it.
Oops, thank you. Representative Marr, will be followed by Senator Elmore.
Thank you so much, Madam Chair. I have a question just kind of generally for all, but want to make a quick comment that I really appreciate, particularly a couple of the physicians over here talking about kind of meeting people where they are. I personally am not hesitant about vaccines, but I represent a lot of people that are and may not have a medical background, and they really do need to be walked through many aspects with their health care. I guess I've got kind of two questions that I'd like quickly for you guys to go through. One, have you given any medical exemptions, and how do you see that process in your practice? It's kind of like if you can, if you've had any that you give, or if you find that it's difficult, I'd like to understand the medical exemption process, particularly for people that have maybe hesitancy on, just a varying bit of concerns with particular vaccines, if you actually do those medical exemptions, and how you find that process. Has anybody done them yet?
Yes. So as a general pediatrician, that's something that we think about, often with our patients, and we talk through with families. And it's very much an individualized process. And of course, we would never want to give a vaccine that would harm a child. And probably one of the most common times this comes up is when a child is either immunocompromised, so whether they're immunocompromised for a short period of time or indefinitely. For example, if they've had a heart transplant, it may not be safe for them to receive certain vaccines. And that definitely comes up and would make sense for there to be a medical exemption. Additionally, perhaps a more rare time this has come up where there's actually been a severe anaphylactic reaction to one of the components of a vaccine, that would be a contraindication to giving a vaccine. So again, that would be a really important medical exemption that we would want to discuss with the family and come up with a plan. And I also wanted to highlight, oftentimes these children may need to see, or may already see, a medical specialist. And so that decision sometimes is made in collaboration with, for example, a specialist in allergy, or a specialist in transplant medicine, or cancer, or whatever it may be, to make the best possible decision for an individual child to keep them safe and healthy.
So just to add to that, although the medical exceptions that I deal with are not quite probably what you were thinking about, but so when you deal with immunosuppressed populations from whatever reason, whether they're on a biologic, chemotherapy, they have innate immune deficiencies, it's actually contraindicated in some situations to give live vaccines. So people with advanced immune deficiencies, it would be actually risky and dangerous for them to receive a live vaccine. The example is with measles. So we get people now asking, we want to check our measles titer, and we need to know that you're in a safe spot to be able to receive that. The other obvious things are things like yellow fever vaccine. That's a live vaccine, and it may be required for people who are traveling to countries that have yellow fever as an endemic illness. And we just write them a letter saying that they can't receive the vaccine.
So is there anything short of contraindications? Like if a family comes in and they have a kid that typically has a lot of sensitivities, may not be an exact medical diagnosis, is there a way that they can have an altered schedule to go slower with vaccines, or is that not something you give medical exemptions for?
So I would say, of course, we have to take every situation individually. Every child is different, so there's no way to know exactly what the particular concerns are. And in discussion with the parents, if there is a specific concern that, for example, I, as a general pediatrician, don't feel comfortable answering, I ask for expert opinion through a specialist to see what their opinion may be. There is clear guidance through the CDC regarding what are considered medical exemptions, and we utilize that information to guide our decision making.
And then just one last.
Very brief.
It's very quick. Great. Thank you, Representative. Choice. Do you believe in choice?
So I meet every day with families and talk to them about all sorts of different choices. And I think parents, again, are the experts in their child. Their perspective is so important, and I listen, and pediatricians listen every day. And there are a lot of choices that we have to make every single day as a parent, and we try to make the best ones to keep our children and our patients healthy. And we take it one choice at a time, one situation at a time, and we work through it and we listen. And one of the best things about being a pediatrician is the families come and see us frequently, and we build trust over time. And we have a discussion one day, a couple months later, we continue that discussion. A year later, they come back and they have more things they want to talk about, and things change over time. And we learn to trust each other and talk about these really tough issues. And so choice is a really important part of being a parent and of practicing medicine, and we experience that every single day.
So that's yes.
Could you be more specific on what I'm saying yes to?
Do you believe in choice for vaccines?
I think, if I may,
Yes or no?
I think
I'm
that
not really sure what you're asking.
Mandates, vaccine mandates.
Okay, so you're asking
Do
specifically
you
about
believe
mandates.
that a parent should have a choice to give their kid a vaccine after the discussions with their pediatrician, serious discussions? Do you think that there should be a choice, or should the kid have to not go to school?
So mandates for school is what you're asking about specifically. So as pediatricians, the American Academy of Pediatrics strongly supports vaccine requirements to enter school, which is a really important sacred place that children learn and thrive and grow, and we want to protect that space for all children the best we can. In terms of choice, I don't think any child should have to have a vaccine, and in the pediatrician's office, that choice is within the caregiver's hands, and we help families make that choice. But in terms of a mandate for school, the American Academy of Pediatrics strongly supports that because we know it keeps children safe and healthy.
Thank you, Dr. Markowitz. And Representative Barra, it's 2:28. We have one more quick question, and that's obviously been a big conversation. I'm sure we'll continue to be, but thank you for that. Senator Onmore with our last question.
Thank you. Actually, Representative Mara asked one of my questions, which was helpful. Thank you. I just wanted to make a quick little comment. I think when we're trying to communicate with people in the community, stories are far more powerful than statistics. You can talk about a study with vaccines for 5 million people, but then you have a story of one person with a child standing there and the person believing to the deepest part of the core that it was caused by vaccine. In the social media world, it actually has more resonance than the 1 million people study that was there. And that's part of what we are looking at. We are looking at it from a scientific lens, and people are looking at it from a human lens. And that's part of the disconnect that we are seeing. And we have also changed how we learn things. We used to read, now we listen, and now we watch. And we watch for 3 seconds. And that's how we learn. And that's changing in so many ways, and then we will have to perhaps adapt and start to think in the same manner. And I speak as a physician too, who has really literally seen every one of the diseases, literally every single one of the preventable childhood vaccines diseases. And as a result of that, now Thankfully, we don't see them, and there are no videos. And because we don't have any videos of those children with new onset polio or having seizures from some of the other measles and dying from meningitis, we don't see those anymore, and that's why those videos aren't there, but some of the other videos are there. So I wanted to put that on everybody's radar that from a clinician's point of view, we have to start different communication pathway. And then that may be one way ways to do it. And I know recently there were a few studies that we published on better communication strategies around this. And then they're showing 70–80% of the parents actually, when they are communicated with and heard, they realize they're coming from a place of love. And when they're coming from a place of love, they want to do the best thing for the child. And when you also come from that place of love, you have an opportunity to help come up with a solution which would be acceptable. So I'll leave it at that. So thank you so much, Madam Chair.
Thank you very much, Senator Almar. We have come to the end of our time for this informational forum. I, again, can't say thank you enough. And I think, actually, Dr. Mirza, your words in terms of the shared hope that we all have, whatever beliefs and backgrounds we come from, our shared hope is the health and safety of our communities. And that's what I hope that we can hold on to as we continue these conversations together. Again, my thanks to the members of the committee who joined us here and online, to those watching at home, and especially to our panelists who sacrificed time to be here today with all of us. And with that, any closing remarks, Representative Parish-Teacher? Okay, thank you. We're adjourned. Thank you all.
Y'all just witnessed indoctrinated, vaccinated, mere ignorant human beings speaking. Now, the handler here at Magnetic Movement is going to make sure you get involved so these dumb fucks don't take away the rest of your life. Just get involved. Well, let's just see. The state of Connecticut has real problems to be solved. And these ignorant fucks aren't the ones that are going to do it. We the people finally get involved. It's how it gets done, motherfuckers. Just saying.